Hello, everybody. I'm just going to wait a little bit longer because I can see the numbers increasing steadily on the participants bar. Hello, so welcome to the webinar on social protection system building, lessons from Nigeria and Somaliland. This webinar is hosted by socialprotection.org, and we're very grateful at Save the Children for them for doing this. Next slide, please. So, first of all, please use the chat box to say hello, tell us who you are, make comments, and share useful links. If you have questions, can you share those questions through the Q&A box? You'll see there are two different boxes at the bottom. State your name and your organization, and if your question is directed to a specific speaker. Do note that this session is being recorded, and after the presentation, it's going to be available on socialprotection.org, and it will be shared with all registrants after the session. If you need captions, check the CC closed captions button, and that will give you captions. If you're on X, then do interact with us and comment using the hashtag #SPOrgWebinar. After a brief introduction, we will look at the lessons learned in Nigeria from the ESPID project, and then we will turn to what looks like a very different context, that of Somaliland. We'll have plenty of time for questions and answers before we close down. So today we have a panel of experts with us who have between them very extensive experience in social protection, in understanding child poverty, in delivering on humanitarian cash and voucher assistance. We have Dolika and Nkhoma, who until recently was the manager of the ESPID program. She has over 15 years of experience in social protection in both Zambia and Nigeria. So in Nigeria, she led this particular program, but in doing so, she built on quite long-term experience working for FCDO in Zambia on the well-known Zambian cash transfer program, and has great experience in managing a wide range of partnerships. Mukesh Lath is our senior social protection at Save the Children, with over 25 years of experience in Asia and Africa. Mukesh has worked with all sorts of different actors in the world of development and can help you across the program cycle. He was pivotal in Nepal in establishing a program for orphans, which was later taken up by the government. And more recently, he's been working a lot in Africa and South Asia, in Somaliland, Zambia, and Burkina Faso. Dahir, who's with us today, he's one of these people who can really bring together thinking about intersectional child poverty, how complex it is to deal with, humanitarian cash and voucher programming, and social protection. He understands youth employment and how to address food insecurity through livelihoods. And between them, these three people are going to share with us some very useful learning about how you move forward from pilot projects and how you start to develop not just programs, but systems in more complex environments. And I'm Julie. You can read all about me when you get this package later, but I am the Senior Social Protection Advisor for Save the Children UK. So the key takeaway for this session is that a standalone program, whether it's social assistance, whether you're giving cash or whether you're giving in-kind assistance, whether you've got social insurance in place or whether you've got pensions, a standalone program is not a system. A social protection system is much more complicated than that. It's complex, it's interactive, it's got moving parts, and it can adapt. In the discussion we had before this webinar started, which was actually really good, I wish we could have saved it for the actual webinar, but Dolika gave us the idea of a system as being like a house. You've got to have the foundation, and that comes from the policy framework. And then you have the different rooms in the house, which is the different programs which address different needs. And then you have to have the mechanisms, the ways of actually getting resources to the right people at the right time, fairly and efficiently. Next. The more common image that we use in social protection is a solar system. And this diagram, there's a link there, which someone will probably pop in the chat for me, but it comes from a really nice piece of work by Starr, which shows you at the center, this is the key building block. This is where you've got the policy, which includes where the funding is coming from, what regular ways of raising money and using that money efficiently are in place. Who is in charge of this? How is it organized in government? Who makes decisions? How do different parts of government talk to each other? It also thinks about the functional and technical capacities. Does the part of government that's supposed to deliver a proper information system have the technology and the skills and the experience it requires? You know, how are other functions being delivered? The blue band is the program design, and we often talk about program design. This is a very familiar conversation in social protection. So do you have good assessment systems? Do you have good ways of understanding risk? Can you use that information to feed into packages of services and benefits that meet a range of different needs? And who qualifies? What sort of programs are you developing? And how do you know who's eligible and who isn't eligible? And then what sort of adequacy is there in place? Are you giving enough? Are you giving it at the right frequency? Is it lasting long enough? And then we move into the implementation and delivery, where everything can go wrong again if a program isn't well delivered, if it doesn't reach out to people and explain what the program involves, if people aren't registered or assessed properly. So each part of this solar system depends on the smooth functioning of the other parts. And an individual program, a standalone program, whether humanitarian cash and voucher assistance or a social protection program, it's not going to cover everybody's needs. We need this more complex design. We need to build this in place so that we have more cohesion, inclusiveness, and potential to build towards proper coverage, enough funds, enough in-kind, enough support, and that we reach everybody and that we can keep this going. So let us move on. And the first presentation is going to come from Dolika. What our three presenters are going to discuss here is how, despite what initially looked like very different contexts, we see similar challenges. We see high levels of poverty and vulnerability. We see a frustration with limited and short-term programs. We see a dearth in some instances of the legal and institutional arrangements that are required to deliver programs. And not only in terms of the laws and the ministries and the offices, but also capacity, whether people know how to do something, whether they know what they're supposed to be doing. We also see serious funding gaps. And quite importantly, in these contexts, we see a lack of awareness about what social protection is and how it is the responsibility of government and how it can make quite a significant difference to poverty, vulnerability, food insecurity, and access to services. So let's move on and see how Save the Children and our critical partners and our funders, who included FCDO and the government of Finland, address these issues.
Thanks, Julie, and welcome everyone. I'll go straight into the presentation. I'll be
Audio,
sharing
Dolika?
lesson. Thank you, Julie. I hope you can all hear me clearly. Just give me a nod if you can. So I'll be giving the presentation.
Dolika, we still can't hear you. Dolika, we still can't hear you. Can you check your...
Can you hear me now?
Yes, we can.
Fantastic. Thank you, and apologies for that glitch. Yes, so thanks, Julie, for that very elaborate foundation. I think you make our work today very easy. I'll be sharing lessons from the Nigeria program. It was called the Expanding Social Protection for Inclusive Development, implemented by Save the Children International in a consortium with Action Against Hunger, with funding from the FCDO, that's the UK's Foreign, Commonwealth and Development Office. Next slide. The structure of my presentation, I think with the background that Julie has provided, I will possibly just run through the earlier slides and hoping that we can have a more discussion and conversation around what we actually did, what the results were, some of the lessons that we learned, and what we see as the obvious next steps moving forward for social protection in Nigeria. Next slide. Okay, so just an overview. I think I've mentioned the fact that the project was implemented with funding from the Commonwealth and Development Office, which is the FCDO, formerly DFID. It was a 4.7 million investment over 3 years, running from August 2021 to September 2024, which is just a couple of months. It was implemented in 4 states in the Northwest: Zamfara, Kaduna, Kano, and Jigawa, with activity at federal level, working with the government at federal level in Abuja as well. Save the Children was responsible for Kaduna and Zamfara, whilst Action Against Hunger implemented in the 2 other states. Next slide. So like we've said in the introductory comments, we did hear about how that pilots are critical in setting the pace, in helping us understand what works in what context. So the SPID program, as I've already alluded to, was a successor to a pilot cash transfer program, which was called the Child Development Grant Program, also funded by the UK government and implemented still with Action Against Hunger. So we've had a very long-term implementing relationship. The CDGP ran from 2013. And at the end of the CDGP, whilst we had a very successful pilot, reaching over 120 recipients in 2 states, we did understand that there was a lot of learning that was coming in. A key component of the program was evidence and knowledge generation. And what we were learning was that besides the program being able to reach beneficiaries and address their most immediate nutrition needs, there was still need to build a system, because the CDGP was a standalone program in 2 states, in Nigeria, which has 36 states. So we found that the work there wasn't sufficient, and that to really see change and progress on social protection, there was need for more work around system building. And from the CDGP implemented over 6 years, what became very apparent was that there was growing policy interest from the government. Of course, Nigeria also started in a similar situation as most African countries, where there's very little knowledge around social protection, not as much support from the government. But I think from the implementation of the CDGP and sharing of the lessons that we were gathering as we went along, there was generally more openness to consider different social protection interventions. And during that pilot phase also, Save the Children and Action Against Hunger were able to build very strong coalitions with the civil society, which was really key in terms of building supports and a cloud for more advocacy. Next slide. And so once we moved on and transitioned the program, transitioned and changed the design to purely system strengthening. So we didn't deliver any cash for the period of August to September. It was purely systems, because there was that recognition. And I think just to give a bit of an understanding, borrowing from the transform course, when you define a system, I think Julie did give us a sense, but when you're really thinking about a social protection system, you're thinking about the legal framework, the selection and identification processes, administration of different interventions, how they are coordinated, the governance structures that you put in place, management and information system, gathering of data and how it's managed, financing and financial management, as well as monitoring and evaluation. So what we tried to do with the SPID program was to really support the government to help them increase their capacity to deliver more effective social protection interventions, because we noticed that there was a lot of fragmentation, a lot of duplication, and very little impact. So if you look at Nigeria and some of the statistics that I'll be able to share, you find that to really make impact and progress, you need to address things in a more systematic way. So that's basically what we tried to do. The project was two-pronged, two broad work streams. Another, I think, building on the coalitions with civil society, we wanted to make sure that there was greater citizen engagement so that citizens could be able to engage the government and influence the design of programs, so that programs were designed in a manner that really responds to needs on the ground as they were happening and as they were prioritized by the community. So I'll just, the next slide will give just a kind of visual representation of what we tried to do. A lot of work around putting in place the policies, legislation, but then also a lot of engagement at community level and with various stakeholders, building of systems, work around electronic payment systems, making sure that those were more efficient, where the government was delivering cash, that there was a mechanism to select the right beneficiaries and to pay them, and to also monitor and gather data that they can then use for decision making. We still continued because in an area like social protection in Nigeria, you always want to ensure that there's evidence gathering and knowledge generation. So we continued to kind of learn lessons and to kind of iterate as we went. But a key component of our program was also around just capacity building, training of government staff at federal level, in the different states, and at community level, to really build that strong understanding of social protection. But then also, like Judy was saying earlier, to kind of help people and work alongside them to really know what works, what is right for the Zamfara context, what works in Kano, what might we do in Jigawa. And the key component of that capacity building also included the secondment of staff. About half of our project staff were seconded into key government entities and agencies, both at federal and state level. And they really worked alongside the different government staff, implementing a range of social protection programs to really improve efficiencies, to learn lessons, and to be able to really drive change from the inside. And that proved to be very effective because it allowed for the building of a relationship of trust and confidence, which then opened the way for us to do more work. Next slide. So maybe just to take a step back, maybe I did allude to this around the rationale for system strengthening. Why did we think this was important to do in Nigeria? And I think our implementing context really is a complex one with a range of intersecting challenges. I picked 6, but this is not in any way a full representation of some of the challenges and some of the motivations for us doing this work. There was just widespread prevalence of ad hoc programs without really a systematic way of addressing poverty. And so we felt that building the systems would be essential and would fill a real gap in the Nigerian context. From the latest multidimensional poverty index from 2022, Nigeria currently has the highest number of individuals living in extreme poverty, standing at 40.1%. And in real terms, that's about nearly 90 million people. And then out of the entire population of 2 million, over 200 million, about 133 people are poor on a range of scales. So there's definitely need for Nigeria then to have a very systematic way of addressing this seemingly mammoth challenge. Over the last years, I think even before COVID, there was a decline in economic growth rate, not keeping up with the growth in the population and other factors. So we find that between 2015 and 2022, the Nigerian economy was only growing at an average of 3.3%, as reported by the Africa Development Bank. And so that really means that for the majority of the population, they were struggling to meet their most basic needs. So then there was really need to do that work. Next, we also saw, no, I've just got the previous slide. I think I've spoken already to the weak systems. So we sought to strengthen that. But then also, for those that are familiar with the Nigerian context, I think what we see now is an intersection of various intersecting and multiple shocks all happening together at the same time. We had COVID from 2020. There are violent conflicts in some of the states, particularly in the northern states, including the states that we worked in. There's climate change, and there are also the economic shock. So when you put all these together, I think that strengthened the case for doing this kind of work. And I think overall in the world, Nigeria currently has the largest number of food insecure people. So therefore, I think that gave us a good platform to build on and to start engaging the government to build systems. I'll now move us over and just talk about some of the things that we did across the different locations that I showed on the next slide. And I will be able to just highlight a few. It's quite a few in there, and the slides will be available. I'll start with the federal level. Throughout the lifetime of the program, like I was saying, we supported the revision of the National Social Protection Policy. And this really sought to bring some coherence to the sector, bring together different actors, including the UN and the European Union, to really understand and agree how they would interact on the ways of working, which agency would lead, so that there's stronger governance, so that there's stronger coordination, and also that there's a means of financing social protection. And then Nigeria currently, the government is currently implementing a social cash transfer program with support from the World Bank. This reaches about 10 million households. And it's called the National Social Safety Nets Program. And so our staff that were seconded to the program worked alongside the coordinating office for that to revise the guidelines for the coordinating units, to develop implementing guides, the strategies, and also planning for the scale up, which started this year. And what we really saw was that as they were working alongside the government, they were able to really share knowledge, but then just infuse different ways of working. Nigeria has probably what is one of the largest social registries of beneficiaries in Zambia. Not Zambia, Nigeria. I'm sitting in Zambia and speaking about Nigeria, pardon me. Yes, and so our staff worked alongside the government to revise some of the targeting indicators to make them more disability friendly, for example, more inclusive, so that they're able to reach more households with disabilities. We did a lot of work with civil society as well, supporting a coalition of different networks across the states to, first of all, get registered because they were not, so to establish, putting in place that sort of institutional structure, but then also supporting them to clarify their mandate, to build, to develop a strategic plan and really strategize how they engage and support the government. We did a lot of work around inclusion, like I mentioned earlier, working on GBV and really building a loop. There's a grievance mechanism that has been set up for the government's cash transfer. And some of the grievances that were coming through had to do with gender-based violence. But at the time that the project was being implemented, there wasn't a means of addressing that. So through our project, we're then able to work with the government to develop a directory for referrals so that whenever such grievances came through the system, there was a mechanism to link beneficiaries to services and to allow them to be able to receive either counseling or accommodation and whatever services were required. We did a lot of work with other development partners. Save the Children served as the secretariat for the donors group, which was chaired by UNICEF and the European Union. And we saw that as a very critical and key position because then we were able to engage using the lessons that we're learning from the field to really help to set the agenda, to help set the direction for social protection and trying to understand how the different donors could work together to support the government to push things forward. I'll move to the next slide, which talks about work at the state level. In Jigawa, again, like I mentioned, as I speak, keep thinking about this work as the foundation, as the architectural design that you have for the house, and then you'll see how it all fits together. In Jigawa, we supported the development and drafting and approval of a social protection policy and law. Jigawa was one of the first states in Nigeria to have a social protection law. So that was a big achievement for the program. And beyond just developing the law, we then worked with the partners to develop an implementation plan to prioritize and really take this forward, because often we develop laws and policies and they gather dust on the shelves, but we were really deliberate about working with the government to make sure that we then support them to move to the next level, to make these priorities that they've identified a reality. We also supported the setting up of a social protection agency, again, making sure that the mechanism, the structures are there within government to deliver. The policy has been reviewed to address some of the emerging challenges. We've supported them to develop an old age pension, so building the social protection system which deals with different risks and different challenges for different people. And Jigawa, amongst the states that we worked with, building on the pilots that we supported during the CDGP, the government of Jigawa state has been able to develop and implement a fully government-funded program for mothers with children. It's called the Jigawa Maternal Child Cash Transfer Program. It's quite a mouthful, but this is government really learning from a pilot and taking it forward with their own resources. And when you think about the systems building, the back office things, we worked with the Jigawa state again to build an MIS system, a management and information system, to allow them to have a mechanism of gathering information and being able to use the data they're getting from the ground to make decisions. Across the states, we supported fiscal space analysis to really get a sense of where the different governments sat in terms of social protection financing, because that's a key component and that's a huge gap, not just in Nigeria, but many other places. So initially identifying the areas in their budgets where there could be room for reallocation of resources and better structuring and usage, and then further supporting them to develop financing strategies to identify well-informed and designed programs that they could implement and how they would finance them over the long haul. Would it be introduction of new taxation or cutting expenditure in one area? So we worked with the governments in the different states. I think similar work was done in Zamfara. And Zamfara, I think one thing I would like to highlight there, that they didn't even have a ministry responsible for coordinating social protection. So once that ministry was formed, the Ministry of Humanitarian Affairs and Social Development, one of our staff was seconded there to support them. And we were able to help them clarify and build their mandate, develop a strategy, which they are now implementing, and they're beginning to identify different interventions that they could finance from their own resources. Next slide, please. Similar work, I think, was done in Kaduna. And here, perhaps, what I would like to highlight is around a project that we helped to design, focusing on the youth. And this was really born out of the recognition that there was high youth unemployment in the state. And we worked with the different agencies of the government to develop a program which the government will now take forward and implement. As a result of our engagement and advocacy with civil society, Kaduna State has committed 1% of its state budget to social protection interventions. And once it's up and running, then we expect that programs such as the youth graduation program would be funded from that resource. In Kano, a lot of the work was around the policy, again, supporting the government to set in place the architecture that is needed to deliver social protection. Next slide. I want to highlight the work with civil society because it was so critical in not only building understanding and sharing of knowledge around social protection, but then also for civil society positioning itself as a critical partner of the government. So some of the areas that we worked with the different partners across the 4 states was around budget tracking and analysis. And this then was able to provide the government with information that gives them a sense of how the budget was being executed across the states. And this really formed a basis to engage. If there's been an allocation of a particular amount, how are those funds trickling down to the communities or to the end users? And what's happening? Are there any leakages, and how can those be strengthened? Speaking of advocacy of the allocations, how can those be improved, and similar work? So our civil society partners were really instrumental in conducting these, and they would conduct regular briefings, engaging the government and just sharing what they're learning from the ground. Again, there was a strong integration of gender and social inclusion issues, ensuring that there's space. Again, those GBV referral services were set up at state level as well. And victims have been able to access support, and just building a greater understanding of what gender inclusion is and what it might look like in a social protection program. A lot of advocacy and stakeholder engagement, engagement with governors and senators right across from federal level to the states. And this is something that we kept through media briefings, so just publishing short briefing notes to just highlight some of the issues that were arising from the field. Another area was to really build accountability. I spoke about citizen engagement when I made the introduction. Working again with different actors across the states to monitor government interventions, to really ensure that services were reaching the intended people. And lastly, there was an integration of shock response, because like we've mentioned, Nigeria does face a range of challenges. And so ensuring that as we support the government to develop programs and develop the system, that these are programs that could be adapted to respond to different shocks that were arising. So this in a nutshell summarizes some of the things that we did, and I'll move over to the next slide to just highlight a few lessons and challenges that we faced. I think whilst we started on a very high note from the CDGP pilots, as we were going towards the end of the SPID program, we're starting to see a decline in political will and commitment to the government. I think initially there was a lot of excitement, there was a lot of interest, but with time, we saw that that was beginning to slow down. And so we were constantly thinking about how can we maintain interest? How can we ensure that Nigeria, social protection still remains on the front burner in Nigeria, given the different issues. And then also there was just an increase in poverty overall, particularly after the COVID pandemic. And so we see that more households were now falling into poverty, perhaps faster than in previous years. So working with the government then to kind of support them to build the systems that respond to that isn't always possible in the short term. So that's another, that was another emerging problem. Still, I think with all the policies that we've supported to develop, I think just ensuring that there's that coherence across the different bodies of government is still a challenge, and we still saw high levels of fragmentation across the piece, with ad hoc programs still coming on and taking center stage, whereas the kind of more long-term investments were beginning to slow down. Capacity gaps at individual, organizational, and institutional levels, those still exist. And it's really capacity arising from changes in staff and just movement, but then also because it takes a long to kind of build and understand, a long time to build and understand what social protection is and how to do it properly and how to address all the issues. So I think that this is something we are constantly bringing to the fore, the fact that this kind of work really does need a longer horizon to really invest in the system, to make sure that it's embedded within the day-to-day work that the government does. And I think overall, there's still just a limited availability of reliable data, and this limits the ability of the government to be able to plan adequately and to just meet and find everyone. In terms of the lessons on the next slide,
Dolika, you're almost out of time, so can you be speedy on this one? I know it's your last.
Thank you. I know it's the last slide. Thank you, Julie. I think that, as I've mentioned, I think coordinating across different partners is key if we want to see benefits maximized and really working to limit duplication. The importance of partnerships with civil society, the media, and others. I think the point I was starting to make from my previous slide was around building systems, how that it's such a long-term endeavor, and it's probably one that spans over decades rather than years. So whilst we're able to make a lot of progress, I think that there's still work to be done, and any planning and programming in this space should really be looking at a longer time horizon. The last slide, I think in terms of next steps, we do see a critical role and still space for technical assistance to the government. I've named a few that focus on social protection, and really there's need to build upon the work, no need to reinvent the wheel. Any future programming should really be looking at a very strong strategy to respond to needs as they emerge. But then also, I think thinking more around how best to engage the government with a very complex governance system. What are the ways that we can work and think politically, as others have said, to really navigate the program? Do we think about structured dialogue with the government and other partners, or what would that look like? So I think I would be happy to kind of, in the questions, to kind of think through ways of better engagement with the government to really make sure that we get the understanding of the politics right. Thank you.
Thank you so much, Dolika. Please add your questions to the Q&A box. Mukesh and Dahir, over to you.
Thank you, Julie, and thank you, Dolika, for that very interesting presentation. And let me now take you from Nigeria in the western side of Africa to the rather eastern side of Africa, and talking about Somaliland, and also changing the context quite a bit, from Nigeria, where there's so much investment still, at least at the national level, by the World Bank and other donors and the government. Of course, it also has its own challenges at the state level, not to mention national level as well. We're kind of moving into a context that is Somaliland, which is extremely fragile to start with, politically very sensitive, and having its share of poverty and vulnerability. So before we sort of move into what our program is all about over there, and how we've been engaging with the ministry and the government in Somaliland to develop a social protection policy, I'd just like to quickly run through some sort of facts and statistics around poverty and vulnerability in Somaliland, especially for those who are not so familiar with what the Somaliland context is like. So a current estimate of poverty really sort of put about 78% of population in Somaliland as living in extreme poverty. And not to mention climate change and frequent occurrences of natural disasters like floods, flash floods, or droughts sort of make life difficult for people even more. In the last 2 decades, there have been 12 episodes of drought in Somaliland. Unemployment is particularly high, and especially among young people, and that sort of spans across rural and urban areas. COVID actually sort of, was again a big problem, where in urban households in Somaliland, about 42% of them lost on their income. Those are some of the big problems in terms of poverty, but then these challenges manifest themselves in the form of child poverty, and 67% of births, for example, in Somaliland are delivered at home, and 61% of women, an equal number of nearly women, say that the big challenge and obstacle to accessing healthcare is money, as well as significant distance to health centers. Now, all of this also manifests in the form of high levels of malnutrition. Around 21% of under 5 children are stunted and 13% wasted. There is low levels of enrollment in school. The gross enrollment rate at the primary level is around 34%, and 1 out of every nearly 8 children in Somaliland tends to be in child labor. Next slide, please. And just to mention that people in Somaliland do face risks and challenges across the life cycle. During early childhood, there is really limited anti and postnatal services, limited immunization. School-going children face the risk of not being able to stay in school, like I mentioned, abuse, poor home environment. The youth and working age, for example, suffer from having inadequate skills for employment, and of course, also inability to access training for employability. Not to mention that at that stage they have increased cost of child care, debt, and of course gender discrimination. With that background, just to say, we started a child-sensitive social protection program in Somaliland, and I'm talking about the current program, which started in January of 2022 and goes up to December of 2025. But this is the second phase of a child-sensitive social protection program. The first phase actually started in 2018 and went up to 2021. I'll speak more to that, but just to say the current phase is for until 2025, and it is supported by the Ministry of Foreign Affairs of Finland as the donor. We're implementing this program in 2 different locations within Somaliland, one in the capital city of Hargeisa with IDP households, and the other one in the coastal district of Berbera, where we have the big port, and we work with urban poor households over there. It's not a very big program. It's not a pilot anymore because it's in the second phase, but it's only sort of working directly with 625 households. And I want to specifically mention that to really sort of to say that small pilots can also generate a lot of policy level engagement and work. So as you can see, the budget is not big ticket. It's just 2.2 million across through the 4 years. What's interesting is that the child-sensitive social protection program. Why child-sensitive social protection? Because when we came into Somaliland in 2018, we started having discussions with the then MOLSA, Ministry of Labor and Social Affairs, which is now the Ministry of Employment, Social Affairs and Family, on social protection. And the starting point was that there was extremely limited understanding around social protection, what it is and what it can do. And we did see huge levels and vast levels of child poverty and vulnerability. And as Save the Children, we were completely committed to advancing the idea of social protection, and especially child-sensitive social protection. So the starting point for us really was to actually initiate a pilot so that we would be able to engage the government and like-minded agencies to start thinking about social protection, working on social protection. And that gave birth to a child-sensitive social protection project. This is a project or a program that's been sort of implemented very closely with the government. They've been part of designing this program with us. And currently, as I said, we're working with them in these 2 districts. So basically, this was a starting point for us. And in the last 6 years, we've made quite a bit of progress, and the journey has been quite interesting. And we'll come to more on where we've gotten with regards to influencing policy and program on social protection. But before we get to that, just a quick look on what is the approach, the CSSP approach in Somaliland. So next slide, please. Yeah, so basically the child-sensitive social protection program in Somaliland starts with the fact that given that the time when we started this program, there were hardly any social protection programs in Somaliland, we had to initiate a pilot cash transfer. Can you please just go and yeah. So we basically started piloting a long-term cash transfer program with the government. This is basically currently a $20 transfer per household per month, with sort of eligibility criteria that really sort of caters to households with at least 2 children. And the targeting over here is very community-based. The government is very much involved in targeting and selection of the households over there. When I say government, I mean the Ministry of Employment, Social Affairs and Family. So this is a starting point for us to really sort of create the whole idea around need for social protection and long-term cash. Somaliland, as a lot of you would know, has had a lot of humanitarian assistance going on, a lot of cash voucher assistance that goes through humanitarian program, but extremely limited long-term cash transfer programming. So the idea was to start the whole initiative on social protection through a long-term cash transfer program. But then, based on experience from other countries and contexts, and it's also from Somaliland, it was clear that unless we linked beneficiaries of this long-term cash transfer that we are providing to services, especially services for children such as health and education, we wouldn't be able to achieve the real impact from that cash transfer. So the other key aspect or component of the program is to link social protection or let's say long-term cash transfer beneficiaries to government social and basic services. And this is achieved through really setting up transparency and social accountability mechanisms where we get the service providers from the government side and communities to come together. This is very community-led, so a lot of impetus and focus is on building capacity of the communities to be able to demand some of the services that they're entitled to. And this has had really, really very high-level results in terms of in the area that we are implementing the program. There have been health centers set up, education investments made in terms of schools or facilities within schools, also to the extent that one of the IDPs has been granted land by the government to be able to settle themselves there. Now, another key aspect of this and the centrality of all of this work is the one area which is enhancing child sensitivity. So the argument and the reason behind this is that we want to make sure that any income accruing at the household level results into investments in children. And therefore, we've designed a very contextualized parenting program in Somaliland. And we run that parenting program with households that get the cash transfer. The parenting program is really to sort of improve child and caregiver relationship. It basically comprises of a foundational set of parenting sessions, and built on those are sessions on nutrition and education, family budgeting, so that people who are receiving the cash transfer are also investing in children's needs and rights. And one of the interesting aspects that we heard from people during the last phase's evaluation was they valued the parenting intervention equally as much as the child grant of $20 a month in terms of how it has impacted their children's life. Quickly though, and based on these three key components of work on the ground, we've been engaging a lot with the government at the national level. They've been very much critically a part of implementing this program. And what we've done at the National Social Protection Policy and Strategy level will be covered in the next slide. So I'm not going to say much, but that's an important cornerstone of the approach in our program, to use all the learning and experience from the ground to influence policy and program. Evidence building, as was said earlier also in the previous presentation, is so key to us. And here we are really focusing on building more evidence on the cash plus approach, the cash plus parenting approach, as to how cash plus parenting, when combined with cash, has positive outcomes for children, as opposed to households receiving just cash, or children in households that receive just cash. And assessment from the last phase and recent assessments from the midline of this phase are clearly pointing to the significant improvement in child development outcomes for those households that receive cash plus and cash both. Last but not the least, I wanted to refer to the shock responsive social protection side, and we haven't done so much on this, but just to say that there was a pilot on shock responsive social protection that was mounted on this particular program in Somaliland back in 2019-20. And the fact that this was funded by ECHO and the Somali Cash Consortium, this long-term cash transfer program was the only possibility to actually launch a shock response intervention to see how we could actually get through and provide horizontal and vertical expansion and benefits to people in the event of a shock. And there's sort of also used as a basis to create a standard operating procedure of how shock responsive interventions could be used and promoted in Somaliland or initiated in Somaliland, just to sort of highlight that a small pilot did have the potential to actually even be used as a pilot for a shock response. I think we want to focus more today on how we've been influencing social protection work in terms of coming up with the social protection policy and how we've gotten there. And the next slide, please, is going to explain more about that. But let me hand over to my colleague Dahir, who's going to take us through this. Over to you, Dahir.
Thank you very much, Mukesh, for the elaborative background and illustration on the work that we have been doing in Somaliland. Just to also talk about from the initiation in terms of the Thailand and what the key activities and milestones we have done since 2017 when we initiated the program, was that it was the first program, social protection pilot that Save the Children or maybe another partner has implemented in Somaliland since it is reclamation of its independence in 1991. So we have actually come together with the government, co-created and designed this pilot, intending that social delivery actually is being given to the poor IDP communities in Hargeisa, but also most importantly to establish the foundations of social protection system. And in doing so, we have actually agreed with the government, Ministry of Employment, Social Affairs and Family, MESAF, and key social protection actors like Havayoko, which is a local partner that actually co-create and co-implement with us the social protection program to build their capacity in terms of providing structured trainings that Save the Children has been providing in-house or has been liaising to international think tank, social protection think tanks like Development Pathways, who provided physical and online structured trainings to both these key stakeholders as well as other stakeholders in the country. We have also doing parallelly learning tours like exposure visits where the key staff, the technical staff of the ministry, local implementing partner, and Save the Children technical team and program implementation team to the countries that have matured and as far as Nepal. So these kind of exposure visits actually sensitized the government and other stakeholders to actually prioritize and gather an understanding and exposure on what social protection is like and how it is important to this context in terms of child development. We also embedded, seconded some technical teams with the government where social protection by Save the Children and other P agencies to also advise and support the system building. While we are doing this capacity strengthening plan, we have also parallelly started in 2019 a social protection sector common strategy, which actually aimed to provide a strategic analysis of existing social protection landscape in Somaliland, inform the development of social protection systems, including the formulation of social protection policy, and that actually sensitized and triggered the government's prioritization of social protection policy. And it was as a result of this common study where the government proposed that now is the right time that we need to formulate a social protection policy, which is national, which is actually lay the foundation stone for our social protection. And then the key stakeholders, including Save the Children, has been invited to develop and support terms of reference for it, fundraise, reach out to the global think tanks for social protection, and then try to formulate social protection policy, which is context relevant, consultative among the partners, communities, and children in all regions of the country. that has helped the creation of a social protection working group led by MESAF, where the key stakeholders, local authorities, including municipalities, Ministry of Finance, Ministry of Planning, other service providers like Ministry of Health, Education, local civil society organizations, and other international actors and present in the country come together and establish a social protection working group that actually coordinates and tries to fundraise and facilitate the work of MESAF in actually finalizing this social protection policy. And other relevant work. So that creation also facilitated that in the national plans, because it was the time that the National Development Plan 3 of the country was about to start. And then that group, that task force actually tried to influence the Ministry of Planning in actually recognizing that social protection is a sector and worth to be recognized as a sector in the upcoming plan. And it was 2023 and 2021, where Save the Children, MESAF led Save the Children supported task team that actually work with the working group has realized it and convinced the Ministry of Planning to recognize social protection as a separate sector in the National Development Plan 3. Parallelly, there has been a consultative, inclusive, participative kind of policy development think tank, which also not only formulate a policy, but also tries to provide capacity strengthening trainings that are physical in Hargeisa for all working group members, which facilitated actually a common understanding of the social protection. It was new to the country. And actually supported that the team who are the technical for the ministry actually grasp the idea of doing it in-house together with these lead actually consultants from development pathways. The policy has been finalized in 2022. A social protection policy has been translated into Somali language, but also an advocacy effort has been embedded into the program so that the working group came up with the funds, the timing, and the plan to reach out to the decision makers, including Cabinet of Ministers, members of the parliament that are responsible in social affairs, the key other actors, including local civil society organizations, so that a familiarization workshops for the policy has been conducted in the capital city and in the regions. People actually grasped the idea, and then there has been a common understanding among a technical committee from the Cabinet of Ministers, which is responsible on social affairs, which was mandated to review the policy before it is passed to Cabinet of Ministers for approval. Another aspect which was so important was a transition from social protection working group to a social protection sector coordination. Since NDP3 has actually recognized social protection as a sector, then the coordination mechanism has to be established. And MESAF has initiated that the previously existing platform, which was the social protection working group, has to now transition to a sector coordination mechanism, which leads to social protection efforts in Somaliland. That work coordination mechanism also took a very good effort in terms of implementing the advocacy plans, advocacy efforts. using different approaches and different challenges and channels, where early this year, January, finally, the Cabinet of Ministers have approved the social protection policy, and the launch ceremony and the first social protection conference has been held in Hargeisa to celebrate this key milestone. One other aspect that I would not want to forget is that during the initiation of social protection program, which actually Save the Children has been implementing, when we came back from one of these exposure visits, the government technical team has decided to also lobby for including some budget with the national public funds to the program and then provide the social transfers from the government funds. Fortunately, they have done these 2 transfers, after which they could not sustain because of the shock of COVID-19 and some other climate-related shocks, which actually affected the government to prioritize other services. As Mukesh has also talked about, we have piloted shock response to social protection, where we have established a technical committee led by MESAF and National Disaster Management and Food Reserve Authority. That committee, together with colleagues also from the National Displacement and Refugee Authority and the community in one of the IDP camps that we support, has actually tried to monitor some key indicators that has been actually tried to agree to trigger for social protection. And we have, for the first album in 2020, as Mukesh has said, now the current plan is that MESAF is prioritizing social policies for they initiated that through the sector coordination platform. They fundraise and actually prioritize this as the top of their priority agenda. Where
Hi, Dahir. We're beginning to run out of time. I don't know if you can speed things up a wee bit.
Consultant has been also added. Consultation is for the. Thank you, Chile. I will quickly, please, next slide, please. So we are actually thinking on the activities that we have been doing since from the beginning of the program up to this implementation strategy, which is now current development. So the question may become, why invest in social protection in Somaliland? And as per Mukesh's presentation, is addressing a large-scale emotional vulnerability, which actually 75%, 78% of the people in Somaliland have experiencing extreme poverty, to provide social protection system, build social protection systems in Somaliland. Social protection is seen as one of the early and essential steps in the state building process, particularly a very fragile and new countries that are now building. Somaliland, which is not recognized, which has some political challenges, where the relationship between the government and the citizen is actually can be built through these social protection systems. The other agenda and main rationale is to shift to humanitarian aid to long-term development, where regular and predictable transfers require an effective social protection system to be built, so that government funds plus donor funds can efficiently used to support the vulnerable people for child outcome, for child development outcomes. That also builds the legitimacy of the governments and authorities, and it increases the willingness of the people of that country to provide and pay the taxes so that they can also do their part of system building and government. Next, please. And in terms of the lessons learned, the way that we have been implementing these advocacy events and policy development and consultations were very inclusive, where we build partnerships not only within the government, but also within civil society, community, and municipalities, and also participation of the community that we are supporting, including children. Collaborative lobbying and advocacy activities has been done, where actually these sector coordination mechanisms are actually helping to reach out to the networks, including members of parliament, cabinet of ministers, through different channels and timings. Save the Children leadership has planned actually to have a separate government engagement at all levels, including the president, parliamentary and ministerial levels, through different channels, but most importantly, the highest level in the country, leadership met with government leadership as well in the presidential office, in the parliamentary buildings, and then have some kind of discussions and prioritize the social protection policy approval and system building. The capacity strengthening plan that I was talking about, the empowerment of the government technical team through training and the civil society organization is actually materialized and helped a lot. And celebrating achievements together with the key stakeholders, including the launching ceremony for the policy, the first ever National Social Protection Conference, and the launching of this community study actually has helped to gather some kind of common objective among the key stakeholders for social protection. Next. Finally, the next step is as per the priority of the government, is the finalization of social protection strategic plan, which is currently undergoing. Then a generation of more evidence on the effectiveness of child-sensitive social protection approach, the evaluation that Mukesh was talking about, of particularly focusing on the impact of the cash plus parenting approach on child development outcomes. Finally, the government has prioritized the development of social protection systems and functional administrative assets, including social registries, MIS, and other relevant tools in its plan. So that is from my end. Thank you, Julie and the team, and over to you.
Thank you very much, both, all of you, Mukesh and Dahir, and also Dolika. So we've had some questions, and I'd like to move to those. So I'm going to start with a question from Barbara, because I think this is one that sort of applies to everybody and is of general interest. So she says, great presentation, thank you. I'm surprised about the policy framework that seemed to have been an easy enough benchmark. It's not always that easy. How did you manage to convince governments to pass a legal framework and get the foundations right from the start? And how does this systems building dimension, these are two questions actually, well done Barbara for sneaking that in. How does this systems building dimension clash with donors' notion of quick wins and social protection indicators that are mostly quantitative and focusing on poverty outcomes? So please, short answers so we can go around the room and get to several questions. Let me start with Dolika.
Thanks, Julie. So I think a quick response to Barbara is that it wasn't an easy one. It wasn't an easy benchmark as you would, but I think that as we implemented the program, we then were very deliberate about putting certain things in place. I spoke about the secondment of staff to government institutions, which was very key. that helped us to identify key change agents within the government, who then became very useful in ensuring that these processes were moved along. So we worked with people in the Speaker's office, in the Governor's office, to really ensure that there was that internal buy-in. Another thing we did was to work with the media, just so that there's a sustained advocacy from different sources through the different channels to really obtain that kind of wide influence and coverage of the issues. Another thing, working through the civil society coalitions, as I mentioned, identifying elder statesmen who are then able to kind of find their way through the corridors of power to support with some of the advocacy. I think the other thing I would want to just highlight here is that what was really key is, rather than just going and saying we want this policy passed, we worked very closely with the government, the different entities and agencies, to really co-design and co-create, ensuring that the need for a particular project or particular policy or law was well understood by all parties involved, engagement with the parliamentarians, like I mentioned, the governor's office. So it was a lot of work, not easy at all, but I think achieved through employing different strategies.
Thanks, Dolika. So either Dahir or Mukesh, maybe Mukesh, you go first because we've just heard from Dahir. And then we'll just take one person on the Somaliland experience, and then we'll take the other one on the next question.
Yeah, just quickly on the Somaliland side, convincing the government, I think there were two things here. One, like I said, when we started this pilot, we kind of engaged the government from the very beginning. So they did see the impact of long-term transfers that come to households and what impact it can have on children. I think one of the key things I'd like to mention over here is that we kind of, initiated the scoping study. And I think that was such a big thing for us, that was the game changer in many ways, because the scoping study that we did really brought out the value social protection can add, and the sort of way in which it can address poverty. Even sort of like one of the recommendations in that report was that even if we started a small child grant and sort of over a period of time tried to cover a substantial portion of children in the country, 65% of extremely poor households would get covered by the program and be able to really sort of come out of poverty. So that was a recommendation that the government also really took, and it was interesting because at the same time the government was coming up with the NDP2, National Development Plan, and they asked us to comment, and we took that opportunity to really push for social protection policy and work on social protection. So it was also picking up on those very important moments, and not to say that was also a time when the federal government of Somalia was really building on and developing its own social protection policy, which also triggered the Somaliland government to think alike. So there are lots of different factors that were working there to really sort of push for the social protection policy. But yeah, it's been a long sort of engagement. We started in 2020 and we only got it launched in 2024. So yeah, and quickly on the clash, of building social protection systems and the interest of donors on humanitarian quick wins, for instance. I think there's a lot of recognition at the donor level also and among the humanitarian world that long-term social protection systems are critical. Of course, they have their own sort of limitations of what they could do here and their own sort of priorities around humanitarian help. But I think what really works and what we are seeing in Somaliland is for the government to really take lead on and put it on the table that we are here sort of thinking more of a social protection system that could eventually even cater to humanitarian conditions and not really looking at just immediate wins. Those are important, but a longer term solution to ending poverty and addressing vulnerability and poverty. And I think the MESAF in Somaliland, for instance, has really been sort of, pushing that agenda with donors. So that's just to say. Yeah.
Thank you very much. The next question I'm going to address to Dahir. Sorry, I'm picking and choosing amongst the questions to try and be fair to everybody. So from Mahamadou Maiga, in Somaliland, how are access issues resolved to reach all vulnerable people? How is the social registry linked up with, I guess, the registries of the humanitarian actors, and taking on board ideas around community conflict and data security? So I guess asking how you're bringing together different registries and how you're sort of managing the scale of need in Somaliland?
Thank you very much, Julie and Mohamedou, for asking this great question. Actually, Somaliland has yet to build a social registry, which is common across for the country for social protection and other humanitarian actors also to use. So it is now planning to build one. And yes, there is one in Somalia, but there is some political tensions among them so that they cannot use. So reaching out to the most vulnerable actually is also something that we do it in different approaches. For example, some of the agencies like Save the Children use several approaches to reach the most vulnerable. We use community-based approach, where the community structures that we train and build their capacity in terms of identifying the vulnerabilities in their community, because they know each other better than us, actually support and facilitate the selection of these beneficiaries. But also we use some kind of vulnerability-based targeting and our systems, where we sometimes identify some key criteria on who is vulnerable and where, in terms of geographical location and household targeting, so that we target based on that approach. And sometimes we mix the two approaches, where we use community-based, vulnerability-based mixed methodology to reach out. But particularly in this program, we have been using community-based targeting approach, where the community structures plus government, mandated Ministry of Employment or Social Affairs actually facilitated this targeting so that we reach these. And in terms of community conflicts and data security, there is currently been ratified a data protection law in Somaliland, which actually supports also the social protection policy. But the humanitarian organizations and social protection implementers in the country are also mandated to comply with the data protection laws in the country, and those the international data protection laws. And we are actually confident that we are abiding these laws, and no violations have so far been accused in either of the implementing partners that are actually doing social protection services in the country. I think that is a bit of an answer to your question, Mohamedou. Thank you very much.
Good, a very strong attempt. Okay, thank you. So now to Dolika. Okay, you're in trouble. So Shuaibu Musa Kafingana says, in Jigawa State, the Disability Fund was launched at the end of the year 2021, which was supposed to be part of the achievements recorded by ESPID, but it wasn't captured in any of the slides showcase. So come on, why didn't you mention this fund?
Yes, I think indeed that's one of our gains in Jigawa, and not captured, not because we don't acknowledge it, but I did speak very broadly around the work that we did to put in place the institutional framework for delivering social protection across the states, and really working with the different states to set up agencies that are dedicated to delivering social protection. So the omission wasn't deliberate at all, but I was trying to make sure I stick to the clock, and also that our slides kind of communicate the key things. But I think we do have a longer list of achievements which will be made available after the meeting. Thank you.
Thanks, Dolika. Then I'm going to go to a sort of a bigger, actually this question goes right to the heart of the challenges we face, and it's going to be, so I'll ask Mukesh and then Dolika to respond. And also Dahir perhaps for this one. So what are the sustainability and exit strategies embedded in these programs or projects? So we see lots of projects arrive and then they stop at the end of external financing. So how are the effective implementation of interventions guaranteed, and especially the policy instruments and laws that have been generated through the programs that Save the Children and its partners have been supporting. So yeah, how to keep this going, what happens next. So Mukesh, over to you.
Thanks, Julie. And that's a really, really important question, isn't it? That it's a question in the room. I think, with regards to Somaliland specifically, the whole idea of initiating the child sensitive social protection pilot was never to actually run a project. We started the pilot only to make sure that we are able to bring in the whole idea and concept around social protection in Somaliland, especially focusing on children. So, like I said, the whole planning of that project was initiated with the government, and the idea, and I think I mentioned it earlier, this project doesn't reach out to a large number of people, as opposed to many other interventions as such. The thing is that when we are implementing this project, a lot of the implementation is happening through the ministry itself. And the idea was that they should be able to see the benefits of a social protection intervention, what it can do for children, and eventually how it can contribute to the economy. So for us, even the component, and I'd like to sort of mention this here, this whole work around Cash Plus that we are pushing through in this pilot is to really for the government to recognize and accept the value of Cash Plus, because this is a debate and discussion that's happening globally now in social protection. And in Somaliland already, we want to make sure that as the government starts to develop the social protection strategy, they're able to include the Cash Plus elements, such as interventions like parenting or other Cash Plus elements, which will ensure that there is more to cash and there's more needed to do in addition to cash, for instance, to bring outcomes, especially for children. And as Save the Children, we're always going back to the focus on children and the development outcomes for children. So like I said, the sustainability bit is so key. And for us, the whole idea of this intervention is to make sure the government really adopts it. Like Dahir mentioned, we kind of really convinced the government, and they were convinced to actually contribute to this cash transfer. They started the cash transfer, they couldn't sustain it. That's a big challenge for us, and like we were earlier discussing in Somaliland, one of the big challenges is that we are investing in a lot. There's a social protection policy. As we speak, we've just had the presidential elections happen. The previous government in power had put it on their election manifesto to start budgeting and investing in social protection. What happens next, we don't really know. But the whole idea is to have the government to start investing. We don't want to keep running these programs and projects. For us, our sort of success indicator for success would be that this project actually becomes redundant, and that the government is able to sort of take up. The government, just to say, has shown great ambition and even announced that they would come up with a child grant of their own in Somaliland. This is, of course, sort of being pushed through this intervention. Now, when we get it, how do we get it is a big question mark. But then the whole idea of interventions like these are not to do it as an intervention to cater to a set of or to a certain households. The whole idea is to use this as a platform, really, to push the government to start investing in social protection.
Thanks, Mukesh. Dolika, over to you. And we've got 6 minutes left in the whole webinar, so short and sharp.
Short and sharp, yes. I think that when we started the presentation, we spoke about how that pilots have been used as proof of concept, really to demonstrate what's possible from implementing short-term social protection interventions. And the intent always is that these are interventions and programs that the government can then take on and implement and finance from their own resources. And that's why I think when we think about system strengthening, from the earlier slide I showed, we kind of cut across the piece, thinking about selection, thinking about financing, thinking about the governance structures. And I do feel that if the work is centered around that, ensuring that there is that foundation set, it makes it easier sometimes for the government to then take up interventions and start to build, because you'd have put the building blocks on how they can move ahead. Otherwise, we'll always have the problem of one project is implemented here and everyone moves ahead. But I do feel that system strengthening projects are unique in the sense that they allow for things to be put in place. There's a law that's in place that guides how social protection interventions will be delivered. There's a policy that guides. You couldn't possibly just make it disappear. You have to repeal the law, for example, for it not to be there. And we've done, I think in Nigeria, we did a lot of work around just developing the implementation strategies as well, and getting those budgeted for and financed and moving along. But of course, given the complexity of the challenges and the problems, it's not work that's going to produce results overnight. I think there's that recognition also that this kind of the complexity of the challenges requires more long-term investment. It requires more work, even more hand-holding of the government beyond just the initial intervention that's there. The other bit, which I now forget, do you want me to touch on the second question, Juliana, about how we guarantee and how we lead? I think I've probably spoken to that. I think beyond just ensuring that the law has been approved, how is that taken forward? Is there an institutional framework? And so working with the government to kind of set up the institutions and sometimes the agencies that will deliver these sorts of interventions are really some of the ways that we've tried to move that along.
Thank you. And Dahir, could you give your thoughts, 2 minutes, and then we'll wrap up.
Actually, Mukesh has said it all, but the commitment that actually has been created among Somaliland decision makers in terms of the current parliamentarians and the government, the current government actually was promising, so that they are coming up with their own initiatives. The commitment from the Ministry of Finance in our last engagement was that they are very willing to also formalize some informal social protection support that actually they provide to previous veterans, people with disabilities, and some other support services that actually need formalization through Ministry of Education, Ministry of Health, including basic primary health care and the like. So the commitment is promising, but hopefully we don't know what it will happen because the transition of the yesterday's elections. But fingers crossed that the uptake will actually, our commitment will stay strong. Thank you.
Thank you so much. And I think between you, you've given us a really great account of how the foundations are put in place. I'm sorry we don't have time for more questions, and thank you very much today to everybody who joined us today and who kept us company during the discussion. Anyone who registered will be sent links to the various resources. If you check out the sp.org site for this webinar, there are other resources there, and there'll be a blog later this week. So once again, thank you very much, everybody, for joining us today. And whatever the rest of your day looks like, I hope it goes well. Bye-bye.
Thanks and bye.
Thank you. Bye.